Good afternoon, everyone. Welcome to the Casey Chambers Q2 Healthy Casey Networking Forum. Our event today is in partnership with the Casey Chambers Executive Women's Leadership Council. I'm Brandy Riggs, Vice President of Human Resources at McCown Gordon Construction and Chair of Healthy Casey Networking Forums. We're so glad you could all join us to discuss the timely topic of shaping the new normal. Today, we'll hear from leaders across our community as they share how their businesses are evolving as we move forward out of this pandemic. We welcome you to participate today by submitting questions via the Q&A feature or in the chat. There won't be a dedicated time for open Q&A. Instead, we'll do our best to address your questions towards the end of the program. I am now honored to introduce you to our moderator. Stacie Engelmann is Vice President of HR Consulting with Lockton Companies. Stacie, welcome, and thank you for leading our discussion today.
Thank you, Brandy. I'm excited to be here this afternoon and introduce our amazing panelists to the group today. You know, early on in the pandemic, and gosh, even up to maybe 6 months ago, it was common to hear someone say, I can't wait for things to get back to normal. I can't wait for business to get back to normal. I can't wait for life to get back to normal. Yet, as the health and human toll of the COVID-19 pandemic continued, as weeks and months went on, business leaders have recognized a unique opportunity to shape what a new normal will look like for their business and workforce in the months and perhaps years to come. Please join me in welcoming our panelists this afternoon, who will share what this new normal will look like for their business in their organizations. We have Renita Mullman, Chief Administrative Officer with Burns & McDonnell, Tracy Platt, Executive Vice President and Chief Human Resources Officer with Cerner, Wendy Woodson, Director of Human Resources with GBA. Before we look ahead, let's take a moment to reflect on the past year. Each of our panelists today and their organizations have led their businesses through an incredibly challenging year. I'd like to invite the panel to introduce themselves and share maybe one or two things that their organization has done well this year that they're especially proud of. Renita, I'll start with you.
Good afternoon, and thank you, Stacie. Looking forward to the panel today. My name is Renita Mullman. I'm the Chief Administrative Officer for Burns & McDonnell here in Kansas City. A couple of things that I feel like we've done really well over the last 14 months is we shifted very, very quickly to and very smoothly to, a complete work from home, which is unheard of for Burns & McDonnell to have anybody working from home, much less our entire workforce of 8,000 people working from home over the last 14 months. So we did that very seamlessly. Kudos to our IT department. We had very, very few hiccups when we first went to work from home last March. Can't believe it's been a year already. And so that's been very smooth. And then the second thing I think we've done really well is as we started to bring people back into the office is really the safety measures, the cleanliness measures, things we put in place in our facilities so that when people are returning back to the office, they feel very safe in the environment that they're working in.
Great, thank you so much, Renita. Tracy?
Thanks, Stacie. Great to be with you all today. A couple of things I'll maybe headline. Tracy Platt with Cerner Corporation. I actually joined Cerner right before the pandemic hit, including relocating my family right before the pandemic hit. So not only the environment, obviously, that we're all contending with and trying to navigate, but also joining into the community here in Kansas City, and haven't had a chance to really completely embed yet as a part of that, but looking forward to that as we go forward. A couple of things I would hit from a corporation perspective. Obviously, we're in the business of healthcare, which has created an incredible, I would say, opportunity and challenge in that, given the clients and patients we ultimately serve. It was a time where they're looking to us to help enable, right? to say, how do we ensure that you're both helping us manage the flow through clinical workflow within the system, in addition to really supporting the hospital systems on every dimension from a technology capability to help them solve the problem, right? Not only on the forefront of when the pandemic started, but we've also taken a pretty strong role within the community, in particular with vaccination administration that we're really proud of. And we've actually had 90,000 vaccinations that we've been a part of administering with a number of the hospital systems here locally. So that certainly, as we think about where do we start in the conversation, is really with the clients and patients we serve, and we're really proud of what we've been able to help stand up there. I think also our associates here at Cerner, I mean, just remarkable in terms of response, and didn't miss a beat on any dimension of productivity, delivering on behalf of our clients across the globe in the pandemic, when literally over a weekend we went fully virtual. With the exception of those that are actually in the hospital systems, working arm in arm in that dimension. And then thirdly, I just would reference, we've really leveraged our charitable foundation in a very strategic and unique way to kind of answer the call. Within the Kansas City area, standing up, we set up a number of initiatives, including Feeding the Front Lines, a way to both contribute as a corporation, but also to allow and frankly enable our associates to contribute time and talent as a part of that. So that'd be a couple of things I hit to start the conversation, Stacie.
Great. Thank you for sharing, Tracy. And a belated welcome to Kansas City.
Thank you.
Wendy, I invite you to share.
Hello, everyone. Wendy Woodson, Director of Human Resources for GBA. So we are an engineering, architecture, construction management, and consulting firm here in Lenexa. So we, very similarly to, as Renita was saying, is we were all very shocked at how quickly we went home. And that was not something that we had done in the past. We had not worked from home. So we had just moved to the Zoom platform right before everything hit. So that was just really very lucky timing, but it enabled us to stay connected and go home and be productive. Our IT team did a phenomenal job of keeping us all productive and connected, and we did great. And then secondly, I, again, like Renita, I was so pleased at the way that we were able to bring people back in phases safely, following protocol. Our facilities team had the PPE, the partitions, people spaced out. And so again, the flexibility of the leadership team and the support in being able to come back in those phases and keep people productive and connected was a few things I thought we did really well. I was very pleased with.
Great. Well, thank you. Thanks to each of you. What an incredible year of transformation and change, definitely. In preparation for today's webinar, we reached out to attendees to conduct a pulse survey to share what their organizations were currently doing, or what status maybe they're in as it pertains to return to office. And we wanted to share a few of those highlights with you today. So in this, you can go to the next slide, please. In this survey conducted of, again, area Kansas City organizations, only 15% of respondents said that they had returned everyone to the work site. Again, this was just conducted in the past 2 weeks. So fresh off the press results here, but 51% of participants still have more than half of their workforce working remotely. You want to go to the next slide. Well, nearly 1/4 responded they anticipate having their workforce back to the office in the next maybe 1 to 3 months. 40% said it's still unknown at this time. And when they do return, most are taking a strategic approach by limiting the number of employees on site at any given time, where less than 20% plan to have all employees on site on any given day. For many, nearly 1 out of 3 survey participants said they still don't know. Respondents also noted you can go to the next slide, thank you. Respondents also noted they plan to offer a number of work flex options as they return employees to the work site. The most common from 70% of survey participants being a hybrid workforce, which is that two-tier workforce made up of individuals who can work remotely and those who must be on site to do their jobs. This multifaceted approach can create big challenges for leaders in HR and across the business. You know, prior to March 2020, as maybe a couple of our panelists have already shared, many organizations may have been resistant to some of those approaches. And yet COVID-19 has pushed organizations over that maybe technology tipping point. And in a number of months, the COVID-19 crisis has brought about years of change in the way that companies in all sectors and regions do business. One recent survey from McKinsey found that responses to COVID-19 have sped up the adoption of digital technologies by several years, and many of those changes are going to be incorporated here for the long haul. I'd love to hear from each of the panelists, you know, what phase of that return to office or return to work site is your organization in currently, and what's the anticipated timeline, if that's available yet? We heard from many of the survey respondents, we still don't know, but if you've shared that, what's that anticipated timeline look for your organizations? And secondly, for those of you implementing a hybrid approach, how are you planning to structure that offering? Tracy, maybe I'll start with you.
Yeah, happy to weigh in here. So, you know, Stacie, I was thrilled to hear you say return to office versus return to work. And I think that's a really important designation, because as you look at the data set, you know, kind of globally on this, and we know there's been meta-analytic studies done that prove actually that employees can be productive and have been productive. So regardless of where they're, you know, working, so to speak. So I love the return to office. And I think it's important for anyone leaving the conversation today to really understand how important that designation is as it relates to the workforce, given how productive associates and employees have been to date in not having been technically in the office. So appreciate you setting the context there. You know, what I would kind of come from this lens is a couple of factors. You know, one, we're in the business of healthcare and technology at Cerner. And I think, you know, most of us have seen a lot of the trends being set around really the future of work through tech. You know, they were the first adopters to go out and say, hey, we're shutting down facilities, we're pushing people live wherever they want to live. And, you know, frankly, there's not going to be a specific destination for office like there was in the past. So that's something we were actually assessing well before the pandemic as we think about how work can get done. The majority of our workforce are knowledge workers, right? So as you think about how work can get done, there's some flexibility there versus if you're, you know, standing on an assembly line, obviously, or if you've got specific service orientation in more of the, you know, the hospitality industry or other things. We've got some enhanced flexibility there that we've been frankly looking at for a while related to workforce and frankly the hand-to-hand combat of talent. War for talent related to tech talent, which is nothing less than ferocious as we think about, you know, that mix. So for us, it's really been an opportunity to accelerate on a trend that's already been in play and to really think about the work. Say, what does the work require, right? And really what that educated for us, we did a full kind of analysis across our workforce. And really there's a few of those jobs, you know, that frankly are physical, right? It may be, hey, we're running data centers, or hey, we actually have facility people, or hey, X, Y, and Z. But that's a pretty small number. And we estimate about 10% of our workforce really requires a physical kind of, 9 to 5 presence, so to speak, in an office setting. Then we have another segment, which is primarily our kind of Kansas City footprint, which we would argue is dynamic. We're calling it dynamic under the hybrid framework, which is really the mix. And that's a mix of probably around half and half, right? You think about office, when do you come together in an office setting, an office as destination versus a place you go, which technically you could do the same job sitting in your house. But more of what are those activities that really are conducive to being in the office. And that may be things like, Scrum meetings, that may be strategic sessions, that may be ideation sessions, that may be team meetings, there may be other things where coming together is helpful. And then you kind of are deployed back out, in your ecosystem, right? Which could be your work from home. So for us, we're really thinking about, actually we're mobilizing on this factor where it's really a mix in that dynamic sector, which could look different by area. An example with some of our technology areas are like, look, we need to come together for week sprints to actually figure out, code, figure out what the stream of the workflow is. And then frankly, just go out and do your work from wherever you do that, within your home. And then we have other areas that, maybe it's more activity based. And then we have other areas that may be more conducive to more of the 3-day in the office, 2-day outside the office setting. So that's the other component. And then we've got a whole nother dimension, which is more virtual in nature. As we continue to penetrate some of these really tough talent pools from a tech perspective. So that's really what we've been marching towards. And there's a whole lot else in there that I could talk about, but I'm going to leave time for my colleagues to kind of reference a similar sentiment.
Great. Tracy, thank you. Yeah, I think we could probably fill, more than the full hour just with talking on this alone. I love the term dynamic and how you guys are using that. Renita, how about you? How are you managing return to office or return to work site?
Yeah, last summer we got fairly aggressive in June of 2020 with bringing our workforce back into the office all over the country. Some states we have about 50 offices all over the country. So some states were more restrictive than others. We kind of managed that on a state by state basis. We got fairly aggressive in June, July of last year when we realized schools weren't probably going to open back up and our employees have daycare or childcare school issues. We kind of slowed that down. So probably last July, we were at 30-40% back in the office. We're now probably 50 to 60% back in the office. Our goal is to be predominantly a work in office company, as we have been forever, but we are going to be offering more flex days throughout the year, throughout the month, for when people do need to be at home, work from home, they can be remote and still function. Our work is so collaborative and in team environments that we need to have people together working on designs together. And you can do that over Teams or over Zoom. It's just sitting together next to somebody, your 5-minute conversation that you can have with your senior engineer or architect that's sitting next to you, all of that suddenly turns into a 20-minute Zoom or Teams call. And everything, not everything's quite as efficient on Teams as it can be just sitting next to somebody and asking them questions. We hire about 200 new grads a year, so they require a lot of mentoring. About 150 in Kansas City, 150 outside of Kansas City. So they require a lot of mentoring. We need our senior engineers and staff in the office mentoring them, and they want to be in the office. Our new grads, when we've done surveys with them, they want to be in the office. They don't want to be sitting at home. They're 22-year-olds, they want to be in a fun environment. So we're trying to interject some fun activities into our daily and weekly routines as well. And we hope to, over the next month or 6 weeks, get back to where we have the majority of the staff back in the office on a regular basis with the flexibility. Obviously, our construction teams, we have probably 1,000 people out on construction sites. They have no option but to be out on a construction site every day. And they never got to work from home. Even back in March when we went to a work from home environment, they still had to be out on the construction site managing that project on wherever they might be. And they were impacted more probably than our office-based staff, just because they couldn't go home to see their families every third weekend or fourth weekend, which is our policy, to let them have a long weekend to go home to see families. Many of them are road warriors that work on a construction site 2 or 3 or 4 different states away from where they live. So that was more of an impact to them than our office-based staff. But we're hoping by the middle of summer that we're predominantly, back in the office on a regular basis.
Great, thank you, Renita. Wendy, anything else to add?
Not much. Renita sounds a lot like our organization. We headed back to the workplace, again, state specific, very similar. We've got offices across the country, but here in headquarters in Lenexa in May of 20. And so that was kind of phase 1. We've got 4 phases. We're currently in phase 3. We surveyed our staff, and similarly to Burns and Mac is we have people in the field that don't get to work from home. So, construction management, they have to be on site. Our field crews have to be on site. So I think that, we're deemed essential. And so we needed to get back to the office and back out in the field and support our field workers and in that way. And so that if we can get back, we need to. So we surveyed our folks that were working from home so that we brought them back in phases to their comfort level. So if they were eager and ready, and we had the protocols put in place, and we were very intentional about that, and letting them know, this is how it's going to be. This is how we're going to not gather. This is how we're going to separate. And so they came back. Phase 1 was 25%, and then some months later, phase 2 was 50%, and now we're in phase 3 with about 75 or 80% back. So everybody's back that in one way or another, whether it's hybrid or they're not back for certain reasons. So be it, individual health reasons, situational reasons. So we have a culture where people want to be here, and similarly, as Renita is saying, is we need to collaborate, we need to innovate, we need, we have a really strong culture of team orientation, and so we've done a great job of staying connected from our home offices, but many of us are chomping at the bit to get back and work together. So we're trying to make that happen.
Thanks, Wendy. It sounds like, just in terms of the percentage of your workforce, you might be the farthest along with 75% back at the office. Anything that you learned along the way, anything that you would have done differently, maybe that you could share with the group today?
Well, what we learned is people need their coffee. Okay. You cannot bring it back to the workplace unless you've got coffee. So lesson learned, get the coffee under control sooner. And what they really want now is access to the refrigerator. So that's not, we're not there yet, but we definitely figured out the coffee situation. So what we learned too is leadership can trust the staff to work from home and be productive. And that was a huge lesson. We're pretty old school, and, the working from home was just never an option. And now we have a work from home policy, and we don't plan to structure it too much. We're very diversified in our business and in our business sectors and our markets. And so that's really going to be very dependent on that market and that business leader. So not going to be a whole lot of structure to that. We're going to continue to be very flexible, have that hybrid model, and allow the folks that can and want to do that within some parameters. So lessons learned was we can trust our people. Do differently. I don't know. It's a really slippery slope once you let everybody go home and they figure out this works. I think part of that slippery slope is going to be our dress code. I think, people do have to put their pants on to come back to work, but it's probably going to be jeans, and unless you've got client meetings or whatever. But yeah, biggest lesson was about the coffee.
Keep everyone caffeinated.
Yes.
No
They
matter the
demand it.
protocols put in place.
Yes.
I love that. Thank you. Switching gears just a little bit, and Tracy, you mentioned, you touched on this earlier too, but talent development, that's something that may have been overlooked at a time when it may never have been more critical, despite employee motivation to reskill, that development and succession plans may be a focus for HR leaders as they rebuild their workforce or continue to build on their workforce to fill skills gaps, increase diversity and equity, and prepare for future disruption. How do you foresee your talent development initiatives or priorities shifting in the future? Tracy, do you want to take that one?
Yeah, I'm happy to. There's a couple of things I maybe want to hit from the last exchange, if I could, though. I think a couple things is we think about the macro trends of workforce and global workforce. And there's been a number of studies done that have been pretty consistent with referencing about 80% of global employees are actually looking for enhanced flexibility from their employer. And frankly, they're expecting it. It's table stakes now. We know that the COVID pandemic accelerated trends by 5 to 10 years. We know that this was something in motion a while back, and there were barriers. I think, Renita and Wendy hit a few of them culturally, where organizations were like, oh no, I can't trust employees to potentially work from home. In essence, the employees of our workforces are never going back to what it was. That's the bottom line. So as we think about the opportunity to, successfully, regardless of industries we're in, compete for talent with the notion that productivity has been proven, and not just the sentiment of, hey, I'm productive, but we actually measured the predictors of productivity. And guess what? We had over 90% favorability on the predictors of productivity. So as you think about enhancing the value prop for companies and frankly, what employees are expecting, it really is not going back to what it was. And we also saw uplift on inclusion, because now there's no dimension of who's in the office, who's not in the office. We saw 10% favorability in 1 year on inclusion, just because of the scenario of eliminating distance bias. And as a global employer, it's incredibly critical, to completely lean into that. So that's why we are getting very aggressive in the notion of our positioning of how we think about our workforce, in how they can work. And frankly, they are already productive. So now it's just enhancing it versus a paradigm of going back to potentially what was, because frankly, our workforces across the globe are saying it ain't ever going back. So I just wanted to throw that out there for whatever it's worth. I think related to talent development, this is absolutely in line as well, because, not going back, guess what? Leadership has completely changed, and how you lead a workforce that has experienced what our workforces have experienced, through the pandemic, as well as the pressures on leaders now to be able to lead in a way that you may have a distributed workforce model to a degree. And frankly, with all the other conditions we're trying to drive as organizations around what good leadership looks like, even with some of the societal unrest that we've all experienced, through the last years or so. So absolutely critical on development. It's something that, we're taking a pretty strong position to invest in our leaders and our associates to say, how do you create an inclusive environment where you may have a few folks that are, sitting in Bangalore, right? And you're sitting in Kansas City, and you may be in your work from home, you may be in the office, but guess what? Focus on outcomes, right? What do we have to do? And then how do we create those conditions to get the best potential from everyone? That is something we're absolutely focusing on from a development perspective, because what got you here won't get you there.
Absolutely. I love that. I love the focus on leveraging the best of both worlds to create what your culture is going to look like going forward. Renita or Wendy, anything else to add to that?
I would add on the talent development piece. We did a survey of our people managers, our department managers, and some of our project managers. And they all said very similar things as Tracy said. Productivity was their we didn't feel like we had any challenges with quality. Probably the biggest thing that we heard from our managers was onboarding new employees was more difficult, took more of their time to effectively onboard. Part of that is we just weren't used to doing it. And I think as you do it more, you get better at it. So they are getting better at it. But and surprisingly, the department managers actually said they worked more, but they had a little bit better work-life balance because they were at home and able to do stuff throughout the day that maybe they weren't able to get to if they were at the office all day. So we had some very surprising results when we did survey our people managers. The other thing is I know Tracy's team travels a lot. We have 35% of our workforce traveling day in, day out. And that has only come back about 30 to 40% of what it was in 2019. And part of that is many of our clients don't want to see have in-person meetings yet. So as that comes up again, we'll see our travel tick up again. I don't think that we'll travel as much as we did previously. I think for every maybe second or third meeting that we have with a client, it might be a virtual meeting instead of an in-person meeting. So I think our travel in general will be a little bit lower going forward. That's what we're expecting anyway. So we'll see what the end of 2021 and beginning of 22 really start to see what we do with travel.
The only thing I would add on the training development side was we used kind of some of that downtime, when projects were being delayed and there weren't as many client meetings and so on. We did use that time to encourage folks to get some online training and development that they could. So that was a way to stay focused in that. As far as like leadership development, that really did take a back seat and has been delayed. That's just something that happens better sometimes in person and when you're having workshops or mentoring or that kind of thing. We've continued to do some of it, but what we heard loud and clear is that's development that you want in person. So some of that's been delayed and we'll be playing catch up on some of those programs, but we tried to leverage that time at home for anything they could do to develop, online.
So switching gears a little bit to the COVID-19 vaccination, we're getting lots of questions from various organizations, and according to our pulse survey that we ran right before this session, 77% of participants said that their organization was encouraging employees to get the COVID-19 vaccine. However, no one responded that their company was requiring it. Has your company taken a position on requiring vaccinations, and or are you providing incentives to employees who become vaccinated? Tracy, I know Cerner was a host of a large operation, and so maybe I'll start with you on this. Thank you for hosting.
No, thank you. It's a topic that is daily in terms of conversations here with the leadership team. A couple things I would hit that I didn't hit earlier. We've been very closely tied to CDC guidance. And having us kind of manage trend, we've got incredible chief medical officer, chief patient officers here. Obviously, we're in that sector, so it makes it a little easier than perhaps other industries. But we really were matching, like, what are the trends we're seeing? And it may be like, as we know, with India right now, the spike in trend is just like off the map and heartbreaking. And so we've really been focusing a lot of our recent efforts there as it relates to relief and some other dimensions. But here in Kansas City, as we think about, both the trend line and capacity management and some of those things, we've been taking a very conservative approach because we don't want to impact and create more challenge for the health systems. I mean, we're there to serve. So we've taken a very conservative approach about when people come to the office. It has to be, frankly, activity that's conducive to the office and frankly required to a degree to be most conducive based on that. So I just wanted to headline that. I mean, we don't persist, we'll be fully in the hybrid model until probably towards the end of the year, because we're going to be managing that capacity based on guidance as well as the role we play in healthcare accordingly. As I think about vaccination in general, we've got a mix. We've got some of our associates that are actually in hospital systems and they're requiring based on the fact they're in, health system. And so as a result, if the job requires it, then, to do the job, that has to be something that we have our associates get the vaccination if that's a part of their job requirement. We also have the majority of our associates that doesn't require, right? So we're really taking an approach to say, look, here's the venue for you to get vaccinated. Number one, right? We create access, which we've been doing. Also incentivizing to a degree on why it's a good idea, doing education, around that, but we have not moved forward, nor do I foresee it at this point to say absolutely every single associate needs to be vaccinated, right? That's a slippery slope. I think all of us can attest to that in this field, right, to a degree. And, frankly, there's a lot there, but, we're taking an approach to kind of, carrot, here's the carrot of why you want it. Here's the access portal for you to get it. And we'll just kind of continue to, play that out as we go.
And for Burns McDonnell, we're very, very similar. We are not requiring people to have vaccines unless our clients require it to get access onto their sites, or in their facilities in the future. We're definitely encouraging it. And our last pulse survey that we did have about 2/3 of our staff that responded to the survey have been vaccinated. And another 20% said they would get vaccinated. So I do think we'll have a little bit higher percentage than the national average get vaccinated in the company based on what we're hearing.
That's great news, Renita. We are getting ready to do our survey this month on, we're encouraging, but not requiring. And we plan to do a survey this month to find out how many have been vaccinated or plan to get vaccinated. And with the results of that survey is when we will determine phase 4, along with, what's going on in the community and if there's any spikes or whatever in the communities where we are. But we plan to use that survey and report back on the percentage that is vaccinated, and then we can determine our final phase 4, our new normal.
Thank you. All right, so we know that May is Mental Health Awareness Month, and want to make sure that we touch on that today as well. Recent research published by the Society for Human Resource Management found that 41% of employees feel burnt out, drained, or exhausted from their work. Additionally, nearly 1 in 4 employees report feeling down, depressed, or hopeless. We know many organizations, of course, have this top of mind and how they're supporting their workers this past year, but also taking that opportunity to create what's that strategic impact going to be to the organization going forward. What's your organization doing to address the current state of mental health and well-being of your workforce and support the unique challenges being faced during this time? And in what ways is your organization supporting the mental health of workers through maybe the adoption of new resources, new policies, et cetera? Renita, do you want to start with that one?
Yeah, sure. I would love to. So of course, we do have an EAP that we encourage people, if you need to reach out and talk to somebody. We've had the EAP for decades, so it's not a new program, but we are encouraging that. We have added telehealth to for mental health, not only for a physical doctor visit, but we've also added some help there via telehealth if people need to reach out. The other thing that we're doing a lot of just in our offices is trying to have fun, just trying to lighten the mood. We want people to be around their colleagues, having fun, having some outdoor activities when we can, now that the weather is finally getting a little nicer, and really encouraging them to reach out when they need something and have that work-life balance a little bit better. And just talk about things. I mean, if you need to reach out and talk to somebody, whether it's a colleague just to vent or, take a walk with, and talk about what's going on in your life, especially those who have lost loved ones over the last year, whether it was COVID or something else, and maybe they couldn't have those events in their personal life because of COVID. Just really encouraging them to reach out and talk to friends or colleagues or family about what they need.
We know those feelings of isolation and that lack of social connectedness has had a significant impact on individuals' well-being. Wendy.
So we have a pretty robust wellness program, and we, over the past year, have really focused on emotional and mental well-being and behavioral health. We started with a new platform. We have a very strong EAP. We did a lot of sessions related to, depression, anxiety related to the pandemic. We had everybody, Zooming in for those sessions, and it was really helpful just to give them some coping skills. We also started with a new platform. It's called Omada Mind, and that was kind of an app where they could have a real coach, checking in with them, and if they had stress, anxiety, whatever it is, helping them sleep on various items. So we, starting last year, we were supposed to have the Olympics, and so we did socially distanced games and had people outside doing events all by themselves, but with a video. And so we just created some fun, like Renita said, just trying to be fun and engaging, be outside, be together, but separate was our motto. And so doing lots of fun and engaging things. Everybody did the happy hours, and we did the trivias and the get to know you. We had lots of new hires. We're growing. We have been hiring. We had our internship program last year. Not very many people did. And so just keeping people connected virtually. We did a pretty good job. So yeah, we've fared okay.
Great, thank you, Wendy. Tracy, what is Cerner doing to?
Yeah, I mean, it's such a critical topic. It's some of the research that's been presented out there is just striking. Primarily, as you think about people not being able to shut it off, right? And also kind of in tandem with what I referenced earlier, and just kind of the upturn on how leaders and organizations look at performance versus, kind of historic things that, we got to continue to persist in the world of work, which is vanity metrics of, okay, well, I see your eyes, therefore you must be working. Well, that doesn't help when you've got people online and working 24 hours a day. So there's a few things I would hit. Number one for us, we were very conscious to be able to get sentiment from our associates on multiple fronts, including the, turn it off mode and understand mental health, kind of where things were with our associates and their mindset. We had about a 56% favorability of, hey, I'm having a really tough time turning it off, which is pretty bad. That was actually one of our lowest scoring dimensions. Productivity was through the roof, but we started to see some dips around people being able to kind of mentally sustain, right? So as an example, so we took some actions on that. A couple of things. One, to try to expand the services that we had already. And I think a number of the things Renita and Wendy hit on, we also had, right? Through our EAP and really focusing on physical activity around our apps. Like we've had fitness centers that went virtual, and they're offering a Zumba class virtually, and some of these other dimensions. And then really just the standard offerings around, where you could go if you were being challenged. We also focused on leaders. So this goes back to, I see some questions on chat around development, with really helping leaders understand what are the signs, what are the things I can do as a leader to help engage in a meaningful conversation with an associate around how they're doing. Not about work, not about tasks, not about, hey, did you get your thing done, your milestone, but more on how are you doing? How's your family? What are things that, that I could help support you on as you think about balancing some of the demands and some of these other components? So we really tried to focus there a bit for our, leaders and our associates at large. We're also building that in, frankly, with our leadership development programming as we persist. As we think about, frankly, leadership is connecting as much to the heart as it is to the hands, and continuing to focus on educating on some of those components. The other thing is really doubling down on outcome-based measurement. And, what are the activities like measuring on outcomes versus, activity? So we're really focusing heavily there to help persist on some of the mental health, because there's a lot of pressure people feel if they feel like they're being micromanaged, or it's vanity metrics that are driving views of performance versus like we have measurable outcomes. So we're focusing heavily on that within the organization. So I think those would be a few things I'd highlight, but frankly, I continue to be concerned for the workforce of the world on the mental health topic. You think about what everyone's went through the last couple of years here on multiple dimensions, and what it will persist in the future, which is going to be different in getting people prepared to both understand the signs and symptoms, understand in themselves and in others, how do you create kind of that coworker effect in addition to leaders that really lead kind of holistically, and then associates that can kind of understand where they go if they need help. So definitely a focus, and frankly needs to continue to be.
Absolutely. I think all of us can agree to that this needs to continue to be a focus and a point of conversation as we progress forward. Brandy, welcome back. I know we have a lot of questions, it looks like in the Q&A and in the chat, so we might take a moment to hit on some of those.
Yes, absolutely. Thank you everyone for sharing your questions. One of the first questions we received was, what pandemic or safety protocols are being continued or discontinued as you return to the office? Can anyone speak to that?
Yeah, I'll start. I think some of the additional PPE we put in place, the sanitizing stations and conference rooms, I think a lot of those we will continue on, just because when you hit cold and flu season, those are all good measures to keep in place as we go into cold and flu season in a normal year, because flu is very, very contagious in the same manner through contact and other things. So we will continue a lot of those sanitizing type of measures that we put in place going forward. I do think just generally our conference rooms may not be as full, just I think people's comfort level. While we may lift the restrictions on, an 8-person conference room goes down to a 4, it may be that if somebody is having an in-person meeting, they just naturally book a larger conference room, even though it's a smaller group. That's just, I think that's where I think people's comfort level will be. We've gotten very used to being a little more separated, and I think people are going to just naturally take a while to get back to where we're, maybe not in as people's personal space is going to get bigger, I think, and stay bigger. So.
Stacie, I'm happy to jump in. I think number one, we continue to be hand in glove with the CDC guidance, which is really important, right? And that's something that, it's really educating our phase in to really move into the hybrid state, and also the protocols, required, right, where that's concerned. So we've taken a lot of action there. I think the other thing, that we're actively planning for is, so to speak, in the new normal. As we think about facility space planning, there's just multiple things to consider. Our associates will have a designated space as they have, and that we're going to, kind of persist that. But as we think about continuing to be conducive to more of a, if you will, global workforce and kind of that dynamic segmentation, it's frankly having us look at our space planning and say, how do we create spaces that are going to be conducive to that? And also the technology enablement required. So we don't have the distance bias plan. So we're not leveraging spaces that we don't necessarily need. So there's a lot of work being done on that front. And frankly, it's a big part of our success model of the future. And I think just continuing to provide training to folks around the protocols. We've taken a lot of action around communicating actively with our associates around, okay, here's what we're learning this week, right? Like these are the spaces available. If you're traveling to a client site or you're traveling at all, I mean, here's the protocols on what you need to do. And so we've really almost probably taken a little bit almost of a parental approach of really over communicating with some real clear guidance around the protocols, just because, again, we don't want to persist and perpetuate the healthcare system, from our kind of conduct or associate base. So that's a little bit of, what we've done, but also how it will continue to educate as we move forward, right? Because we know that, the mindset of people will never be what it was. Going through a pandemic like this, obviously we can't underestimate, going back to the mental health piece, that people are going to go back to what it was before, because they're not. They're going to remember this. You're going to see that behavior, and they're going to be looking for their conditions to a degree to represent that and the risks that the pandemic created. So that's another dimension that'll be interesting to study later. How has it really changed how people engage, how people physically engage? It's going to be fascinating.
Thank you.
Yeah, I don't disagree. The only other thing I would mention about what might stay is, I think we will probably do less travel. I just, if it's not necessary, then we just found out we don't have to have all the same in-person meetings with clients or whatever. So I think that will be here to stay.
Thank you. Are any of your companies trying to track employee vaccinations? And if so, how?
We are only tracking very loosely, just by doing some surveys, where the only time that we are getting people's information if they're vaccinated is if they do have an exposure. And per CDC, if you have an exposure to somebody that's tested positive and you've been vaccinated, you don't have to quarantine. So that's incentive for them to tell us, but we are not requiring it or managing it, other than if somebody wants to try to get out of quarantining, which is a big incentive for people.
Yeah, similar to Renita. I mean, we have some pretty strong protocols in place around exposure. And, we've literally, probably like a lot of you, we've stood up, pretty active, like, here's what happens, like, here's what you do, and here's the whole workflow, around that. So that, that will continue and persist for a bit, right? I think on the vaccination front for us, it's, again, go back to the work and the requirement. I think a few of the other panelists referenced, if your job requires it, obviously, the job requires it, and then that would likely be just noted, right? This person has the vaccination because it was required to go on a client site. But in terms of our general workforce, it'd be more of a voluntary of, hey, yeah, I can tell you, if I did or didn't. We're not looking to force that, so to speak, at this point. But again, we're trying to take the carrot approach of access to vaccination, and here's all the great reasons why that's a good thing for you.
Anything to add, Wendy?
No, very similar, same.
Okay, I think we have time for maybe to address one more question. For those that have leadership teams that want everyone back in the office 100% of the time, what advice do you have on advocating to them from an HR perspective on creating a hybrid model?
Let me jump in on that one. I think a couple of things I would maybe leave the conversation with. It's a lot of education. And I think, again, it's worked for people as they think about their own career journey, right? Hey, it always happened in the office. Hey, I had to be in the office. The work from home thing was more of a special thing. It really wasn't a way of the world. Well, so a little bit of experiencing difference and really educating through data. And there's a lot of data that frankly is empirical in nature, that is it's like literally like the gospel truth. So we've really taken an approach to educate, and frankly, to provide the data set around workforce requirements, competitiveness related to talent. And really the notion, if you think about another data set, 40% of employees would consider leaving an employer if they didn't have flexibility. Like they actively would like leave. So, I mean, this is the data that helps leaders kind of go, oh, okay, I've experienced it, it's worked. Here's all the demographics to educate maybe a different mindset. And then how do you equip your leaders to feel like they can be successful in that? And so those are a few things maybe for consideration, but we're trying to address all of it. But absolutely, I mean, you know, I think every company probably has leaders that are like, oh, can't do it without being in the office. So.
Yeah, I'd agree with everything Tracy said. And that's why we surveyed our project managers mainly to talk about quality on their projects, financial performance, productivity. And we didn't see any significant drop on that. And we kind of used that data to guide us. And we had very few employees that said they actually wanted to be at home full time. There's a few, maybe a 5% said, hey, I would love to work 5 days a week from home every single day. But the majority wanted that flexibility, that 1 or 2 days a week, or, you know, the option to do it more flexible. So we just kind of listened to our financial performance on projects more than anything.
Ditto. You know, and the other thing I might add is our leadership also enjoyed the flexibility and the balance. And so even our leadership is okay with leading remotely. So yeah, I don't have those managers right now that want everybody back 100%. It's not realistic.
Okay. Well, thank you, Renita, Tracy, and Wendy for sharing your knowledge and expertise with us today. And thank you, Stacie, for leading our discussion. We also want to thank our Healthy KC sponsors, Blue KC, Lockton, Advent Health, HCA Midwest Health, and many more. And thank you to the Executive Women's Leadership Council sponsors, Bank Midwest and KPMG. Today's webinar was recorded, so afterwards we'll send out the link as well as post it to the KC Chambers YouTube account. We appreciate you all joining us today and hope to see you soon. Take care.